right. Well, it even happened to Kirsten Powers, Fox News contributor and Democrat, Obama supporter. Kirsten, welcome to the program. I know you're an Obamacare supporter. I always smile when I'm doing interviews with you, but today I'm smiling, but I know you got a cancellation letter. Are you angry?
Well, I was not happy about it, for sure, but mostly because the president said that if you like your plan, you could keep it, and I don't like it when people say things that aren't true. And so it's less about what happened to me than the fact that this is happening to so many people across the country, which I think is really unacceptable.
Now, what do you make of this report, and we've had it on this program, that next year upwards of 50 million people will get these cancellation letters, cancelling the coverage that they get from their employer? Now, that's how most of us get our insurance. 50 million letters going out next year. What do you make of that? The impact's going to be huge.
Well, if that happened, it would obviously be huge. I'm not sure why it would happen, because Obamacare is really structured in a way to affect the individual market, not to affect large corporations or even the government.
But hold on a second. You cannot offer a health insurance policy unless that policy covers all kinds of conditions and treatments. So old policies which don't meet these new criteria will have to be cancelled. That's why it's 50 million.
Well, it depends, though, because, and this is one of the flaws, I think, in the argument that the Obama administration is making, is, remember, even in the individual market, you only lose your plan if you bought it after 2010. So they're letting people keep what they're calling these junk, this junk coverage, which I don't think that it is, if you got it before 2010, but after 2010 they're taking it away. So there's no rhyme or reason to it, really. If these are such terrible plans, why are you able to keep them if you bought it before 2010?
Are you now an opponent of Obamacare? I mean, would you now...
No, I wouldn't say that.
You don't favor repeal and start again with fresh ideas?
Well, no, I think that they have to do something to fix this problem with people who are losing their coverage. In particular, my biggest beef with them is that they keep claiming that there's all these junk plans, and they're not. My plan is not a junk plan. My plan had all the things that they claim they're protecting us, from not having. Well, I had them, so that's not really true.
But there is no fix. I mean, there is no... If you lay down new standards, and policies have to cover this, then there is no fix.
Well, Congress could change the law. I mean, they could change the law to make it that you don't have to...
The president opposes any change.
That you don't have... Right, well, the president shouldn't oppose that. The president should support people being able to get whatever kind of plans they want. If someone doesn't want maternity coverage, they shouldn't have to have maternity coverage.
But that would destroy the economics of Obamacare. If you don't have lots of young, healthy people funneled into these exchanges and funneled into these plans, the whole pricing of the plans breaks down. That's not a fix.
But that's about the individual mandate. You need the individual mandate to get the young people in, but you don't need to have this maternity coverage for people who are in their 50s. I mean, that's crazy.
Yeah, but that means that's a wholesale restructuring of the entire law, isn't it? I mean, do you favor that? I mean, wholesale restructuring. If you don't like repeal, wholesale restructuring.
I think saying that people can buy the plans that they can keep the plans that they bought, and regardless of whether the government thinks that they're so-called junk plans. I think that is a fix. You got to remember, Stuart, as horrible as this is, it's a really minority of people in the overall insurance market who are being affected.
Kirsten, do you know how angry that makes people when 15 million or however many million it is are dismissed? Well, it's just a small minority.
No, I'm not dismissing it. I'm just saying that it's not the bulk of people who are affected in the insurance market. So I think that you can restructure that part. It's a very small part of the overall plan.
What about next year? I mean, these cancellation plans, notices, they're going out.
Well, that's what I'm saying. If they change the requirements and say you don't have to get rid of plans that don't offer maternity coverage or don't offer mental health or whatever,
now, hold on a second.
Those people won't lose their plans.
Right. So moving towards next year's elections, the Democrats are really in a lot of trouble here. Do you know of any move amongst Democrats which would radically restructure Obamacare and put it to a vote regardless of what the president thinks? Is there such a move?
No, not yet. Though I think it's very stupid of them politically. I mean, first of all, morally it's wrong, but it's also politically not very smart, because they're going to pay a price for this. I mean, they will pay a price for the fact that people are losing their plans because the government has decided that they don't like the plans, and that is not the promise that was made, not the promise made by the president, and not the promise made by most of these Democrats who are up for re-election.